it's one of the most common immunoassays that we have in the laboratory, only second to thyroid testing really, and vitamin D is a very common concern, but it's one of the main concerns in the immunoassay area of the lab. I mean, that's apart from the fact that it's the most common cancer diagnosed in men, and in the top 3 of cancerous killers of men. Well, it's one of the only blood-based screening tests for cancer that we have, and it started over 20 years ago, and things haven't changed. We haven't found a better way of screening for this common cancer. You imagine you might be able to test urine or semen or imaging, or and people have certainly tried to do that, but nothing's improved on what PSA has done, and PSA itself has improved over the years as well. So it's sort of upped the ante in terms of what capabilities we have. It's true that many men will die with their prostate cancer rather than from their prostate cancer. It's still a concern for men who don't want to die of prostate cancer and don't want to die of some other things but still suffer with their prostate cancer. Something that has changed recently is the imaging of the prostate with MRI. So that in the past, if you had a raised PSA, a warning level of PSA, people, well, frankly, that you just get lots of needles into the prostate and hope that one of them finds the cause of that raised PSA. Whereas now you can image the prostate and target the areas that look like they might have prostate cancer rather than this random sampling, and that's far more effective at picking up those cancers. And not only that, but in the biopsy, in the past it was a trans-rectal biopsy, which was the most common form, and that had a small risk of infection, but it can be quite a serious infection. Whereas now the MRI-guided needle biopsies through perineal biopsy have very little risk of infection and are better targeted. So all of that's improved, and then we get into the biopsy level. Once we've got that bit of tissue that's suspect, even that's progressed over the years to a clearer understanding of what type of changes are aggressive and which aren't. And it's a bit unfortunate because we had this scoring system, the Gleason scoring system, which grades things out of 10, and to some men to have a score 5 out of 10 prostate cancer might seem disastrous, like you've got prostate cancer and it's almost a pass mark for what? But a 5 out of 10 Gleason 5 prostate cancer is now considered so benign you don't do anything about it, or even 6. And it's only once you get to 7s or 8s that something needs to be done urgently. So the whole the way of suspecting them, finding them, and diagnosing them is continually changing. Nothing keeps still. It's such an important area that everybody's trying to improve on that system.